Let's jump right into a public health puzzle that sounds, well, completely backward. When it comes to fighting one of Thailand's biggest health crises, it turns out that the professional, detached eye of a stranger is way more effective than the loving care of a family member. I know it sounds counterintuitive, but the evidence is pretty stunning. So let's unpack it.
First, you have to understand just how high the stakes are here. This isn't a minor issue. As the World Health Organization pointed out back in 2018, Thailand has this really tough challenge. It's not just on the high burden list for TB. It's also on the list for TB combined with HIV and for the super dangerous multi-drug resistant kind. So we're talking about a public health battle on 3 different fronts.
And for decades, this has been a really stubborn problem. I mean, despite all the effort and money thrown at it, the infection rates weren't getting better. For a long time, they were actually getting worse. Now this chart tells a wild story. Look at the United States. They've long used a policy where professionals, not family, observe patients. And between 1992 and 2014, their TB cases dropped by almost 65%. Now look at Thailand. During a similar time frame, cases shot up by over 60%. It's a night and day difference, which really begs the question, what was Thailand doing so differently? Well, the answer comes down to a strategy that seemed like a good idea on paper, but in practice it had a huge flaw. The whole approach, called Directly Observed Treatment, or DOT, basically put the responsibility on the people closest to the patient, their own family. Let's just walk through how this played out. The family model got picked up everywhere in the early 90s. And even after the WHO came in with a big, comprehensive plan, Thailand stuck with family members as the core observers. And the result? For more than 20 years, the numbers just went up and up and up. It was a clear, undeniable sign that something was seriously wrong with the strategy. So why? Why did a model built on love and family care fail so badly? Well, this quote from the US CDC way back in 1994 absolutely nails it. It's the emotional ties. Just think about it. Could you force your sick mother or father to take pills they don't want to? Could you fight with your kid every single day about their medicine when they start to feel a little better? It's tough. That love and empathy can get in the way of the strict daily grind that TB treatment demands. And that right there is the key difference. A family member, their job is to provide comfort and support. They aren't really accountable to a hospital if things go wrong. But a healthcare worker, their entire job is based on professional accountability. They're trained for this, their work is tracked, and their main goal is to make sure the medical plan is followed, period. It takes all that emotional conflict out of the picture. So a group of public health experts in southern Thailand saw this problem and decided to try something pretty radical. They decided to take the national model and just flip it completely upside down. They called it non-family DOT. And the idea is super simple, but the change is huge. It's about formally moving the job of observation away from the family and putting it squarely in the hands of the professional health system. And this wasn't just a casual suggestion. They built a whole organized system around it. Starting in 1999, they created this amazing network. Patients could pop into a local health center, nurses would actually do house calls in the cities, and others could just check in at the hospital every day. The secret wasn't just who was watching, but the solid professional system that was built to support them. Okay, so the theory is really compelling. But in the world of public health, theories are one thing. What really matters is the data. So let's look at the numbers, because the results of this experiment are frankly incredible. The hard proof comes from this massive 12-year study of 454 new TB patients, published in the Walailak journal. For over a decade, researchers tracked every little detail to see if this new model was actually working. And the results were just wow. Take a look. The overall cure rate was a fantastic 81.1%. But let's dig in. For patients watched by the specialized DPC staff, the cure rate was 86.1%. And check out the village health volunteers. They hit nearly 90%. Now look at that defaulted column. The number of people who just gave up on treatment was tiny, which is a huge indicator of success. And to put that in perspective, this is the real kicker. The World Health Organization has a global target for TB treatment success, and that target is 85%. This model, when run by dedicated staff, didn't just meet that target, it beat it. That's not just good, that's the gold standard for controlling TB anywhere in the world. So what was the secret ingredient? This chart says it all. A full 95% of the patients in this incredibly successful study were observed by professional health staff. This wasn't a mix and match approach. It was a clear, decisive shift to a professional model. The success is tied directly to who was doing the observing. So, this success down in Health Region 11 wasn't just a local win. It was a powerful, data-backed roadmap showing exactly how Thailand could finally start winning its nationwide war on TB.
But the researchers are also clear. You can't just flip a switch and make this happen everywhere. It takes real work. First, you have to educate patients to get them on board, because the culture says families should be the caregivers. Second, you need a bulletproof system for getting the drugs where they need to go. And third, hospitals and local clinics have to be talking to each other constantly. It's really about building a whole new, reliable, and supportive system from the ground up.
And really, that brings us to the final thought here. The evidence is crystal clear. We know why the old system failed. A new system has been designed, tested for more than a decade, and proven to be world-class. We literally have the blueprint for success. So the data leaves us with one last, powerful question. With a solution this obvious, what's stopping Thailand from rolling it out nationwide and finally ending this epidemic?